Hello, my name is Brittany Sutton. I'll be performing a head-to-toe assessment today with my husband Darius. He's already given me permission to record this video today, and I know that in real-world situations I wouldn't listen to lung and cardiac sounds over a closing bone. Alright, so to start my assessment, I will knock on my patient's door. Knock, knock.
Come in.
Alright, so I'll enter in and I'll provide for privacy. I'll introduce myself. Hello, my name is Brittany. I'll be your nurse today. How are you today?
Good. How about yourself?
I'm doing well, thank you. I'm here to do a head-to-toe assessment on you today. So we'll examine everything from the top of your head to the tip of your toes and everything in between. Is that okay with you today?
Sounds great.
Alright, so I just need to get your name and date of birth.
Darius Sutton, September 11th, 1990.
Alright, and do you have any allergies?
Not that I'm aware of.
Alright, and are you in any pain?
Not currently.
Alright, so at this point I could perform hand hygiene and don my gloves, and I'll raise this bed to an appropriate working height, and we'll start off with obtaining your blood pressure.
Okay.
Alright, so we'll get his blood pressure using the two-step method. So the normal adult systolic blood pressure is 90 to 119, and the normal diastolic is 60 to 79. Alright, so afterward we'll have him do the pronator drift. So my patient will sit up straight, arms out, palms up with his eyes closed. Alright, so now you'll stand and we'll assess your gait. So you'll just walk a few steps towards me, and then you'll walk back. Alright, so after we've assessed his gait, I will go ahead and assess his bony prominences. So the back of the head, the scapula, elbows, sacrum, and the heels. And then we will do a general assessment of how my patient looks. So I will look at his skin to make sure that it's the appropriate color for his race. He's not dusky, pale, or cyanotic. And then also I will make sure that his grooming is up to par and that he's dressed appropriately for the weather. And I will also check skin integrity for the places I can see that's not covered by his clothes. Alright, and then he's already given me his name and date of birth, so he's oriented to person. So now I'm just going to check for a time, place, and situation. Sir, do you know where you are right now?
Yes, I do.
Where are you right now?
I'm at the hospital.
Alright, and where are you here?
Annual checkup.
Alright, and who's our current president?
Joe Biden.
Alright, so my patient is oriented times 4. Alright, so now we can go ahead and start my patient's assessment, starting at his head. So we will check his hair to make sure that there are no nits and no dandruff. We'll make sure that his head is round and symmetrical. And then I'm going to look at my patient's face and make sure that his facial features are symmetrical, and check his affect, whether it's happy, sad, or flat. And then I see he's wearing glasses, so he's using an assistive device. Alright, so he removed his glasses for me, so now I can assess his eyes. We're going to pull down the lid for the conjunctiva. The conjunctiva is pink and moist. Alright, and then the sclera is white. I will turn my light off to perform our Perla assessment. Pupils equal, round, and reactive to light and accommodation. I will use my pen light to shine a light into his eye. And it'll constrict, and then I'll move it away. And then I'll move it back to assist the constriction in the opposite eye. And then I'll repeat that step on the opposite eye to assess the accommodation again. Alright, so after I've done that step on both eyes, I will turn my lights back on, and then we'll test for accommodation. So I'll put my pen light in his line of sight, and then he will look away, look at the wall. And then I'll assess for the accommodation of his eyes. Alright, so after that we'll do the cardinal field of gaze. So pen light in his line of sight. And he won't move his head, he'll just move his eyes to wherever I move the pen. Alright, so my patient is able to pass the cardinal field of gaze. Also, when I was assessing whether he was oriented times 4, I assessed his speech as well, and it's not mumbled, gargled, or slurred. Alright, so now that my patient was able to put his glasses back on, I was able to see that he didn't have any drainage. If he did have drainage, I would have coached it. That would be color, amount, color, odor, amount, consistency, and how the patient tolerates it. All right, so now we can move down to the nose. I will make sure that it's symmetrical to the face. It's not deviated in any direction. I would check for patency by occluding the nostril and having the patient breathe in and out. All right, and then I will get my pen light to assess the mucous membranes to make sure that they're pink and moist and make sure there are no obstructions. And if there is drainage, I will coach it. And then now we can move down to his mouth. I'll have him smile to make sure his smile is symmetrical. And then I'll have him open his mouth. So there are no lesions on the lips. There are no lesions or ulcers inside of the mouth. The mucous membranes are pink and moist. And the uvula and the tongue are midline. I'll also check the quantity, quality, and color of his teeth to make sure there are no missing or broken teeth. I will also check his breath to make sure it's not foul, fruity, or alcoholic. And I will also coach drainage if there was any present. And I'll also assess for assistive devices like dentures. All right, so now with his ears, I would check for any assistive devices and any drainage. If there is drainage, I will coach it. And then we'll perform the whisper test. So, Mr. Derek Sutton, I will perform the whisper test on you. So I'll whisper a word into your ear and you'll just repeat it back. All right?
Cat. Dog.
All right. So after we perform the whisper test, we'll be able to move down to his neck. So far there haven't been any cyanotic or pale or dusky discoloration of the skin, or there's been no open wounds. I'm looking at his neck as well, and I'm not seeing any of those abnormal findings present. The trachea is midline, and my patient will be at a 45-degree angle, and he'll turn his neck to the side to assess for JVD if it was present. We'll also listen for cardiac bruits with the bell of the diaphragm at the carotid artery. My patient will hold his breath while I do so. And we will perform this bilaterally. All right. So now at this point, are you okay? Sure. All right. So now we'll be able to move down to my patient's chest. I would once again check scan integrity, and I will listen to the 5 cardiac points. Listening to the 5 cardiac points, I will use the bell and the diaphragm of the stethoscope. I will go down to the second intercostal space to the right side of the sternum, and I would assess for aortic. And then I'll go directly over to the pulmonic, bell and diaphragm. I'll move down 1 intercostal space for Erb's point, bell and diaphragm. Move down 1 more intercostal space for the tricuspid valve, bell and diaphragm. And then I'll move over to the left mid-clavicular line in the 5th intercostal space for the mitral valve. And I will listen to the apical pulse for a full minute. The normal adult pulse is 60 to 100 beats a minute. And then after we assess the cardiac sounds, we will listen to lung sounds. You will listen in 8 spots. And while you're checking the lung fields, you will make sure that the patient isn't using any accessory muscles in his neck to breathe, or if he's having to use extra effort to breathe. And also the chest rise and fall is symmetrical. So I will use my diaphragm 2 inches below the clavicle. And we'll perform this posteriorly. So I just need you to face your back to the camera. so that my patient can lay back again. So, again, while checking for respirations, I will make sure that he's not using accessory muscles and the chest rise and fall is symmetrical. The normal breath rate for adults is 12 to 20 breaths per minute. All right, so now we'll be able to assess the GI area. So with the abdomen, I would look, listen, and feel. I would inspect the abdomen to make sure that there's no distended veins, any discolorations, any lacerations or alterations to the skin integrity. Make sure that there are no ostomies or drains. I will listen to the lower right quadrant after I inspect. Bowel sounds happen every 5 to 30 seconds. So if I don't hear those sounds in that time frame in the lower right quadrant, then I will listen to all 4 quadrants for 3 to 5 minutes. After listening to the bowel sounds, I will listen for aortic bruits 2 inches above the umbilicus and then 1 inch below. After listening, I will gently palpate each quadrant, going clockwise. And then I'll ask about any dietary habits or restrictions and when their last meal was. After that, I will go down to the genital urinary area. I would ask about urinary and bowel habits, like if there's any frequency or irritation or burning. And I would check to make sure if there are any Foley catheters being used by the patient. Afterward, I will go back up to his upper extremities. So upper extremities, we will test the range of motion. All right, and then I will check skin integrity, make sure there are no open wounds. I will check for IV sites and dressings. After that, I will test bilateral finger grips. And then I would check capillary refill bilaterally. And then I would make sure that the capillary refill is brisk instead of slow. And then I would check radial pulses bilaterally. And I would grade it 0, +1, +2, or +3, meaning absent, weak, regular, or bounding. And my patient will be a +2. Afterward, I would check for edema, whether it's pitting or non-pitting. And then we would be able to move down to our patient's legs. So moving down to the patient's legs, we'll be able to assess for edema, pitting or non-pitting. And we'll also assess our patient's range of motion. We'll make sure that there are no IV sites or dressings on the legs as well, no open wounds or alterations in skin integrity, and no pale, dusky, or cyanide discoloration. We will also check our patient's posterior tibial pulse behind the ankle bilaterally, and we'll check the dorsalis pedis pulse bilaterally. And we'll grade it 0, +1, +2, or +3, and he will be a +2. We will check capillary refill to make sure that it's brisk, not sluggish. And then we'll be able to test our plantar flexion. He'll push down like a gas pedal. And then dorsiflexion, he'll put his feet up, and I provide resistance. All right. So during our assessment, the whole time that we're taking care of our patient, we're making sure that privacy is being provided. We're also making sure that we're checking for skin integrity, and we'll also check skin turgor as well. With skin turgor, you check on the back of the hand, but if it was an elderly patient, you would check on the clavicle. All right. So after I have assessed my patient from head to toe, I would ask him if there's anything I can do to provide him comfort. Is there anything I can do to provide any comfort for you today?
No, I'm okay.
All right, and are you in any pain?
No, ma'am.
All right. So at this point, I'll be able to lower the bed back down to the lowest position, and I will be able to lift the side rails ×2. Make sure the patient has their crawl light. Make sure they don't need anything before I get ready to leave the room. I'll doff my gloves, perform hand hygiene again, and I'll thank my patient. Thank you so much for letting me perform your assessment today.
Thank you, nurse.
My pleasure. All right, and then after that, I'll be able to go document.